I'm doing a 2-year family medicine residency out here, which is kind of like a apprenticeship. We do a lot of obstetrics as part of our training out here. We usually get on average about 1.1 babies per day over at Bethesda Hospital. So it's something that comes up quite frequently in our practice. What follows here is just a small kind of brief presentation, kind of overline the basic things that are available for pain management during labor. I wasn't entirely sure how experienced a lot of the audience would be with labor, if they would have been first-time moms, or this might be a bit repetitive for, it sounds like, everyone here who's had a baby before. But we'll go through it, and it's really not going to kind of provide any earth-shattering information about any of the one options, but if there's any questions that come up, I'm happy to answer them as best I can. Okay?
Mm-hmm.
So I'll try and get this going here. So yeah, so 2nd-year family medicine resident, Steinbach Family Medical. I've been here in Steinbach for about 2 years now, and I'm from Winnipeg, so I'm not from too far away. So just let me get this up here. So essentially, as all of you know here, labor is the process where a woman's body is essentially getting ready to deliver the baby, and it's our job to help provide a safe and supportive environment for the mother and the baby throughout that process, which includes making sure that baby's doing well, mom's doing well, and that everything in the environment is controlled as we can make it, so that she's not in excessive pain or discomfort or in any kind of distress. And we do our utmost best to make sure that this is tailored to the woman's own preferences for how her labor proceeds. And which is really important because every woman will go through labor differently. There are more challenging labors than others. There's different experiences that people have had with either themselves or their family members. Things can change quite fluidly as things progress. So it's important for all of us, especially the healthcare providers, to keep an open mind as things keep going, and to try and keep the mother's experience or the mother's wishes and desires for her labor in mind as we go through those stages. And fortunately, there are quite a few ways that we can do to at least help one aspect of labor, and that is the pain aspect, which is by and large to some extent inescapable, unfortunately. Again, some labors can be a bit more challenging than others. But we do have a lot of good resources that we can do that include both medical and non-medical treatments to help make this as positive experience as we can make it. And of course, we're always willing to work with you as much as we can, so long as things are safe, to try and help you have the labor experience that you want most. So the first thing that I'm going to talk about is some of the non-medical pain relief. So these are things that really help set the environment to create as least a stressful environment that we can make it, if there is such a thing in labor. These are more the non-medical, just kind of conservative therapies that we have available to us. And they're really basic things that I just put here. They can be things as simple as, just changing position can really affect how a woman's progressing through labor. For example, if she's having a lot of back labor, then just getting that baby to move around a little bit can help ease up on some tension that might just be too much at that time, and can really make a big difference. We do have sterile water injections that the nurses do here as well, and they're not infrequently done, and there is actually good evidence that they do help make the labor experience better in some cases, particularly if there is that back labor where a woman's feeling a lot of that pain towards her back rather than kind of in her kind of uterus area on the belly. And I have a picture in the next slide showing kind of where we would inject just under the skin, little pieces of water. It burns a teensy little bit, kind of like a very mild needle, and then it helps just relieve those nerves from firing in that area so that you don't feel all the pressure that's going down there as much. I included aromatherapy because some mothers like to have oils or fragrances that can help decrease the stress of the environment. I know at Bethesda, they're a little bit more strict about what they can provide. I don't think they allow candles or things like that, but sometimes if you ask the nurse, they might be able to allow things like oils and whatnot. Some women like to have music that's comforting or familiar to them to help decrease the stress. And then, of course, it's a bit more difficult in COVID times, but things like family members who can be there or doulas are all help create that familiar environment that just takes that edge off of the stress and then hopefully taking the edge off of the pain we're able to. The kind of more meat of the presentation, if you will be kind of more talking about the medical management and some of the things that we can do during the labor. And so I'll jump into those after the next slide, which kind of just shows where those pressure points would be if we were to do sterile water injections. And as you can see, there's little points just kind of in that lower back area where we would kind of inject just under the skin, not even like the full immunization, water points. And the idea is that it helps stop the nerves talking too loudly so that you decrease that pain sensation. Does anyone have any questions about the non-medical part of pain management for labor?
What's the science behind, like, how does that sterile water work? Like, what, I'm always curious about
so that's a good question. I think the science is that if you're inducing kind of a little stimulus right at those spots where those nerves are talking to the brain, it's feeling pain in a very specific area. So it heightens the nerves talking to that very small area, the size of the needle stick, and then it's turning off the nerves elsewhere.
Mm-hmm.
So the nerves are kind of focusing on that really small spot where you feel the burn, and they're focusing less on the wider area where you feel the pressure for like the back labor and such. It's actually got good evidence where they've studied people who have had the injections versus women who have not had the injections, and there is a pain, there is a difference between the two, and it seems to be worthwhile. I'm just checking the chat here. Can moms still walk around the building in labor during COVID? I'd like to know too, do 3 days. So yes, so here at Bethesda, it's not like, you know, a prison or anything where everyone's kind of locked in their rooms, especially at the maternity end. There is at least a few parts where women can walk in up and down the halls. We understand that having you in a room for hours on end would just not be a good experience overall. So there's been no real cases of people catching COVID just in the hallways or going to things like blood work or x-rays that I've been aware of. And so having people walk around with either themselves or with their partner, that's totally allowed right now, for sure. Any other questions so far? No worries. Okay, so we'll move right along then. So the next part's about the more medical aspects of pain relief, into the real nitty-gritties. If you guys have any specific questions or details that you have for me, I'd be more than happy to go into it, but it's just kind of a brief overview of what's out there. There are quite a few medical treatments that we can provide, take a variety of forms, including the laughing gas that you may have heard of, medications like opioids or things like epidurals. For the medical side of things, they all have side effects to some degree. However, they've been over many years, going back decades and decades. And we know which doses tend to be safe, at which point we might be running into troubles, as well as how to monitor if there are any problems that are developing. So we do our best to stay away from doses that can cause problems. And we try and keep it within the realm of providing that pain relief without causing issues, and then keeping very good track of what's going on to both the mother and the baby to make sure that if we see some of those problems starting, that we're taking care of them well ahead of time. Just give me 1 second here. Okay, so the first class of medical kind of pain relief options that we have are the opioids. So there's really two main drugs in this category, and that's morphine and fentanyl. So those are two types of drugs that you've probably heard in different settings, either in the news or other hospital settings. They're both very common, used in labor. I know that fentanyl especially is a bit of a bad press for things like drug doses or in the city. It is an extremely common medication used in the medical system to help pain relief, and fentanyl is one of those drugs that it's used kind of here and now medication because it's very fast and then it wears off very fast. So we use it in cases where we might be coming a bit sooner. So as the labor progresses, we think delivery is coming in the near future. Whereas morphine, it usually takes a bit longer to start and then it lasts a little bit longer. We often use that in the earlier stages of labor. And unless someone else joined and I didn't notice, from understand everyone else here has had a baby before. So generally speaking, labors and second or third or after pregnancies tend to go a bit quicker. So we usually use less morphine than we would in a first-time pregnancy. But again, we're giving doses that we're very familiar with. We're staying well away from where we would be providing maximum doses that might be causing trouble. And we give you enough just to kind of take that edge off you into danger zones. Does anyone have any questions about it's kind of a big one sometimes? Okay, so Carissa is a first time and Colton will be a first time dad. So yeah, so I guess I can kind of go into a bit more. The first time labor is just because the cervix hasn't had time to open up. Again, you might have to work a little bit harder to get the baby ready. Sometimes this is the case, sometimes not, and sometimes first time moms, they can go quite quickly. But we do just kind of watch what kind of medications we do give for a first time mom for exactly those reasons that I talked about, is that we don't want to have them having bad effects on baby or mom. So we just make sure that we're not giving them too much and we're kind of spreading it out so that you're as comfortable as you can and baby's as healthy as we can. So this next slide is for a term you might hear. It's called patient-controlled analgesia, and this works with either opioid medications or with epidurals. And essentially it is that we have a preset amount of medication that we can give you. And whenever you're feeling pain, whether it's in a contraction or it's just in general, is you can press a button and it'll give you a little bit of that medication. We keep it within very strict guidelines of how much you can get and how much you can give yourself. So you can't just keep pressing the button and making yourself or baby sick. We make sure that we only, so that it kind of wears off where you're not going to actually overdose yourself. So again, very safe. It's as safe as the epidural or as the opioids whereas the nurses will give. And it gives mothers that chance to kind of be in control of their own pain management. And they often are very satisfied with that effect. So another option that's available is something called nitrous oxide, which is known as the laughing gas. And I have a picture in the next slide which shows what it is. What it basically is, it's about half oxygen, half this gas, which can help really take the edge off of the pain. It's where the way it works best is when you're starting to feel a contraction, you put the mask to your face and then you start taking deep breaths in. And it actually works quite well. Some mothers really swear by it. And it's generally a quite safe medication to give. It can create things like dizziness, or if people are starting to walk them out, it might make them a little bit wobbly on their feet. But often at the point where people are using laughing gas, they'll kind of be more towards the later stages of labor anyways. Sometimes, not always. But again, we watch the baby's doing okay and you're doing okay with it. So it's another generally pretty safe option for pregnancy. And this is just a picture of what it looks like. So some people might feel claustrophobic with these sort of things. You're the one who's holding on to it. So if you're uncomfortable with it or you find it's not working for you, you can just, take it away. But if you're working, then you can just take those deep breaths. It really can help make that pain a little bit better. And then lastly is the one that people often have a lot of questions about, and that's epidurals. So just another form of pain control used in labor. And how it works is that a very small, special kind of tube called a catheter, and it goes into your spine, not into the spinal cord where it's touching nerves, but in the area around those nerves, and it releases a little bit of medication, which helps those nerves to stop talking to the bottom part of the body as much. And it's put into place a specialist called an anesthesiologist, who this is essentially their bread and butter. They specialize in putting in things like hard intravenous lines where you need access to your blood system, or putting people to sleep, or in this case, spinals or epidurals. So they're very good at what we have a number of anesthesiologists over here at Bethesda Hospital. They are available day and night. Someone is always on call to put one in. And they do have a few things that the anesthetist will talk about to make sure that you're aware of the procedure. Because it is affecting the spinal cord, there is always the risk that they can hit the spinal cord. However, this is an extremely low risk. A little bit more common would be having a headache afterwards, in which case, because the brain kind of talks to the spinal cord, it can cause pressure differences, which can cause a headache, but it are pretty rare complications, and the anesthetists are very skilled at what they do, and they do their utmost to prevent anything bad from happening. And it's extremely rare that these sorts of things happen. And so this is kind of what it looks like. They'll have you hunched over like that. There'll be a support person on your front to helping you keep in place and to comfort you. And they put a tiny little needle into your back. They make sure they know exactly where they're going, so they're not going into places where they should. It can be a little bit painful, but they put a little bit of freezing on the skin beforehand so that you're letting them go in. And it's generally a pretty well tolerated procedure that this do, and the mothers are often very thankful that they have it done, and many of them say they just wish they had it done sooner. And basically what it does is, again, it kind of just numbs the lower part of the body to help control the pain. The amount of numbness that you get can depend on how much medication you get. Most women will feel a little bit wonky on their feet once they get it, but a lot of them are still able to walk around to the bathroom and things like that, or position change. Not like you're paralyzed from the waist down. That's something that we would really try to avoid. You may not feel comfortable walking around, especially without help, and I think we would encourage you to have help walking around if you were to have an epidural. But again, they're quite safe for the most part. There are things that we watch out for to make sure that they don't happen. But many women have very high satisfaction rates, and they're very effective at relieving the pain. They're as safe as those other medications that we talked, like the morphine or the fentanyl or the laughing gas. They do have those kind of side effects that we talked about. They can make labor a little bit longer. The studies show, though, that the average time is about 15 minutes. So sometimes, it can stop making you have contractions altogether, in which case we have to kind of see where we're at. Sometimes it really doesn't affect the progress of labor at all, so it really depends. But it's not an inappropriate form of pain control at all. Common, I think, as many, in some cases, 60% of women choose to have an epidural. So there's nothing wrong with it whatsoever. And I would encourage you to talk to either your family doctor or the nurse or the anesthesiologist at the time of delivery, or me today if you have any questions about them. The only thing with them is that you can't really put them in if baby's just about to come out. So we like to try and have about maybe an hour before we're expecting baby to be born, which can be sometimes hard to predict. But so opioids are usually given through something called an IV, and an IV is another type of tube or catheter that goes into your arm, and it goes directly into the veins. So if you kind of see, like maybe on a TV show movies or if you've ever been in a hospital, you might see where they have that pole that's kind of sitting next to them, and then they have a bag dripping down. And so they slowly just give that medication that goes through the tube and then down into a needle that's connected to your wrist or your arm or wherever they have the IV, and then it hangs from there. The downsides to that are that you have this needle that's sticking out of your arm to get a needle poke to have it done. However, it can be a bit of a nuisance afterwards, but usually people are able to just ignore it once it's already in there. And the poles that the medication is hanging from, they have, so that doesn't stop you from walking down the halls or walking to the bathroom or anything like that. It might make you need a maybe, but it shouldn't stop you from doing those things. Whereas an epidural, what it's going to be is it's going to be a tube that's kind of taped into your back, and then it's also hanging onto a pole at the side, except there's a little bit of a machine that just has a computer that controls how much medication you give, because it's only giving you just a small bit of medication into that epidural space, call it, next to the spinal cord, so that it's keeping the air. Does that answer your question, or too much, too little in that? Perfect. And yeah, so with epidurals, really the only thing is that we can't put them right before delivery, but really along the way is a good, there's a lot of good opportunities. Some people like to try to see how they're doing otherwise. Oh, sorry, this is the question here. Yeah, so that's a very good question. So if there's an emergency C-section, what they'll do is they'll do a closely related procedure to the epidural, and that's called a spinal. And that's where they put the medication a little bit more directly into the spine. But it's pretty much has the same safety as an epidural, and it works the same way. So for anyone who might not be familiar with C-sections, generally speaking, in most cases, you will be awake for them, but they'll keep you numb and more very high numb side of things, to the point where you won't really be moving your lower extremities at all during the surgery. They put a curtain between you and the rest of your body so that you're not seeing what they're doing with the C-section. And then as soon as baby comes out, they just do a quick check to make sure baby's okay. And then they let your partner in if you have one there, and then they let you see you and baby in the operating room. So you'll be awake for the whole thing, usually in an emergency C-section, and then you'll be able to see baby right away, if everything is going well, which it usually does. Sometimes baby needs a little bit of support, whether that's, just kind of wiping them down to wake them up a little bit, to a little bit of heat, or sometimes even a little bit of oxygen. In the vast majority of cases, it usually works out like that. Sometimes they do need a little bit more support, but everyone is right there to take care of both mom and baby. Are the pain drug options the same between the IV and the epidural, fentanyl and morphine? I just want to make sure I understand your question. So they don't put fentanyl and morphine into the epidural. They give you special kind of anesthetic drugs, kind of like freezing. The fentanyl and morphine, they are medications that kind of work on your whole nervous system to kind of make you decrease pain everywhere. So I would say the epidural is more kind of a local kind of numbing agent that just happens to numb the nerves talking down to the rest of your body. The fentanyl and the morphine, they kind of work throughout your body, so you're feeling less pain everywhere. Does that answer your question, or? Okay, perfect. Okay. So that's really mostly what I have. That's kind of, yeah, and just kind of going back to this chat here. It's just a special type of anesthetic. It's not an opioid medication, no. And yeah, so that's really what I have for today. Just a quick discussion of some of the main options available for pain control. It's a lot to take in, and the nurse is always happy to talk about it with you when you're there and to go over your options, and the whole team is there to try and make sure that this is as good of an experience as we can make it for you, and of course to make it as safe an experience as we can make it for you. We're always willing to work with mothers of how much pain control they want, if they want any at all. For some people, they want to try any pain control, and we support them as best we can too. Some people want a little, and we support them with that, and some people want a little bit more, and that's okay too. Whatever it is that you decide, we'll work with you on that, and we'll try and do things that are as safe for you and baby as possible. If we feel that something is unsafe, then we will, of course, tell you. And there are some options where we might say that this might not be a good idea at the time because we think it will be harmful for you or baby. But we will, of course, let you know that, and we'll tell you our reasonings for why we think so. And we'll offer alternatives all the time to that we're not just leaving you in distress or anything like that. So that's kind of the main body. Does anyone have any more questions at all? I'll probably just turn off the slideshow and stop sharing the screen now.